Good afternoon, Dr. Kapoor.
Hello, Bernard. Nice to see you again.
Too. I used to think that the biggest killers in the world were things like heart attack, diabetes, cancer, etc. It turns out, actually, that may not be the case.
Absolutely. If we look at the history of fatality, it used to be many years ago, communicable diseases, accidents, things that just put the brakes on your life altogether. Modernization has got rid of those elements across the globe, but we've replaced them with something else. And all the things you mentioned stem from one root cause, and that's called inflammation.
Okay, so if that's the case, then the whole of the medical system is currently geared around either dealing with after the event or preventing heart attacks, diabetes, cancer, etc. But if we found something else, which we'll come on to in a minute, that seems like that might cause a bit of an upheaval in the system.
Absolutely. I mean, the thing is, as we've progressed in medicine, we've learned to diagnose very well. So well that we now have 126,000 diseases in the system. And by the way, 20,000 FDA-approved drugs too. Now, thinking about that, what that's led to is a medical system where you get more and more specialists. And as you get more and more specialists, the doctors distance themselves from the holistic patient. And therefore, what happens is that we as professionals try and manage what we can. If we can't manage it, we refer to a specialist. If they can't manage it, they refer to a super specialist. Each time, the individual gets more specialized in their area of interest. And whether it's chest medicine, cardiology, it doesn't really matter. But they become very specific in what they're trying to do, i.e. mitigate a symptom. So there's more drugs to mitigate a symptom. There's more therapies. There's more diagnostics to diagnose that symptom. But what we have to remember is the root cause of all of this. And as we distance ourselves from the patient, we're also distancing ourselves from the root cause. And with this, we will have a system where we're not quite getting on top of it. We already know that we're not managing chronic disease. Chronic disease is on the up.
Is that right?
Absolutely. And it is the biggest user of our healthcare economy in the UK, but also in the Western world, and now moving on into the developing countries.
And chronic diseases such as?
Chronic diseases such as what you mentioned, diabetes, heart disease, respiratory syndromes, gut disease, joint pains, musculoskeletal disease. All of these disorders are increasing in their prevalence, and we're finding it hard to manage. So much so that the Health and Social Care Act sort of merged healthcare and social care, because at a certain point, all these chronic diseases led to social issues, disability, inability to function in the activities of daily living. So what we've now done is replace the management of these, not with medicine, but with social care. So we have a real problem. And of course, the budgets are not infinite, and people are existing longer. I use the word existing rather than living. And this burden is escalating, and we have not had a solution through this specialized disease model. So we need to do something different.
So we'll come to this, because this sounds really dangerous, because what I get from what you've said is that if you've got, one of these chronic diseases, then the first thing that will happen is you will get treatment for it, which will probably involve some medication. If that chronic disease continues unabated, or even if it's slightly dealt with, then you should say that person now in their life is going to need other types of support or care, hence the connection with social care. And that's going to have an impact on the system as well.
Totally.
So unless we can, and a heart specialist is always going to deal with heart disease.
Absolutely.
Right. So changing the system to deal with this, which we will come on to, that sounds like that's going to be really difficult.
It will be, because it's very difficult to deconstruct convention.
Yeah.
But we must see something happening. As I said, this is now being exported to the rest of the world. And if we're going to look at system management, there's got to be a different approach. Forget about the system. What about the patient? If we could manage this differently, we could add quality of life, not just existing in extra years, as that's what we've achieved. But the quality of life, of disability, of not being able to do what you want to be around for your family, all of these things are very relevant. And we do need to think about this because people want a quality of life. They don't want to just simply exist. And there is an acceptance in our population that if we get to a certain age and these things are supposed to happen, what we're saying is that if we look at this differently, we dig deeper into root cause, find some common themes, this doesn't have to happen.
Okay, so give me some numbers then, if you can. So inflammation is the issue, it's the killer, at the root cause of maybe many of the chronic diseases that you've listed. How many people do we think globally might be affected, and therefore it's going to affect their quality of life and the impact on the other systems affected by inflammation?
Well, if we look at 126,000 diseases, and that number's escalating as technology comes in, we get to label more and more, it's likely that 95% of the global population will have one disease. And if what we're saying is true, which I believe we are, that arises from inflammation. Now, these are people who are showing signs or signals. There's also the invisible inflammation that's happening that hasn't come out yet. So I would say 100% of the population will have some form of chronic inflammation.
Wow, that is a big number. It sounds like a stupid question because in the end, it might actually terminate somebody's life eventually. But can we put a number on how many people each year globally will die from inflammation?
If you haven't died of a fatal accident or an acute septic event, an immediate event that's ended your life, all the other causes of death would have started from inflammation.
Wow. I've got a friend, his sister's 55. She's a little overweight, she acknowledges. And she's got aches and pains. You know, she's a bit stiff. She can't get out of the chair so easily. Walking's difficult. And she feels a little, lethargic. Her energy's not as good. And for her, she's accepting it. If you ask her what's going on, she'll say, I'm just getting old.
Yes, absolutely.
And what you're saying is this could well be inflammation.
I would say it's 100% inflammation.
Yeah.
What we have to remember is that these processes start somewhere. The body's able to cope to a certain point, and then once signals start developing, there are signs in the body that are caused by inflammation. We call it chronic inflammation or even silent inflammation until it erupts with a symptom or a signal. So the example you've given, fatigue, tiredness, well, inflammation is a process. It requires energy. It will deplete things from within you.
Okay.
Inflammation is it requires food and nutrition. It likes sugar. So generally speaking, these individuals crave the wrong foods because as far as the body is concerned, it's fighting, it needs it. Inflammation causes you not to sleep properly. So you produce a hormone called cortisol that creates even more sugar. You become a donut-making factory in those environments. So you put on fat. And of course, you think this is aging, but the reality, it is physiological dysfunction caused by inflammation.
Wow. And from what you've said then, it could start actually when you're quite young, but because you're young, you're virile, you're a lot stronger, maybe more active, the inflammation you've got is actually, and the effects of it are being masked.
Not only being masked, the issue is we are growing up in an environment that if we don't have a symptom, we think we're okay.
Right.
But that is not true. Inflammation is a process that can occur in your body without you realizing it until it causes a symptom. So what we need to do is educate people to understand what it is that might have started this process or is allowing it to progress before the symptom even occurs. And that is what we call human optimization. We look at the risk to the physiology and mitigate it beforehand. So from my point of view, it starts in early life, yeah.
Okay, wow. Early life being?
Depending on your environment, for example, remember that the body reacts to what the brain thinks. the body not only reacts to physical phenomena, it reacts to how the brain works. And we see a lot of stress, tension, mental health. These things can cause inflammation. People don't realize it. It's not in your head. It can reflect in your physiology. So depending on how you're growing up, where you're growing up, what is going on, inflammatory markers can start. Even when a child is born, if the mother's given something, for example, antibiotics, and it influences the gut of the baby, if they're breastfeeding, that can cause an ecosystem disruption, that can cause inflammation. And it may show us reflux, or it may show us bloating, which we manage, we suppress the signal, but it could be an inflammatory process starting as early as that.
So some of the things that are identifiable, some of those things may not be necessarily identifiable in the sense they're not creating symptoms, but if the obesity rates are growing in our young, which they are, that might be storing up massive issues, A, for the individuals, but secondly, for our health system in the future.
Absolutely. So let's think about
that bubble will just continue to run through the system until they get to a certain age where they're going to need a lot of help.
Yes. And interestingly, we're seeing the obesity crisis get bigger and bigger. But we often feel it's the individual not having the motivation to eat right, not having the reasons to eat right, and that's why they're not doing the right thing. It's not always true. When the brain feels fight or flight, i.e. senses inflammation, it creates changes in the physiology that also reflect fight or flight. So the body feels it needs more energy. So it craves sugar or it makes sugar, and that increases your insulin. So you want more of these comfort foods. And this is escalating because that increases inflammation even more, and you get into a vicious cycle. So the obesity is one element, but joint pains, rashes, eczema, there is nothing that isn't inflammation. But rather than look upon these in individual symptoms and treat them individually, we must dig deeper. And I think our silo system of medicine, where we sort of put patients into specialist units, they don't see the bigger picture. They don't make the links between the mood and the eczema, or the mood and the joint pain, or the obesity and the joint pain. And what we do need to do is educate and integrate all of these things as signals and catch them early.
Before we come back to some of those things, let's go back to basics.
Yeah.
What is inflammation?
Simply speaking, inflammation is your body protesting at you. It's sort of screaming at you or shouting at you saying, hello, I'm not right. So this is happening at a cellular level, the very small cell of which you have 30 plus trillion. And then those cells make tissues. So it can then happen at a tissue level. And then those tissues make organs. It can happen at an organ level. So when we present with a symptom of eczema or dermatitis or bloating or wind, that is your body protesting at you. And our natural reaction is to see an expert, and the expert's natural reaction is to suppress that symptom or look for something sinister. Once we've excluded something sinister, then we sort of manage the symptoms. The problem is that these things are happening and they're not identifiable during the normal conventional testing. It is the history that we need to talk about. What has happened to that individual months before that has happened, or even earlier? And then once we've done that, we can explain that their body's protesting. Look at the root cause of why that body's protesting. Some of it's within our hands, and others are invisible. There are some invisible causes of inflammation that are going on in the modern life that we're not aware of. And an example is air pollution. We're breathing in heavy metals. The food we eat, ultra-processed, creates inflammation. It tastes very nice. It's lovely, but it creates inflammation. And the biggest and most powerful thing is stress, or us being reactive rather than responsive.
Okay, so back to the cell level.
Yeah.
Can you tell us actually what happens chemically or physically in the cell, which we now call inflammation? What is actually going on?
So we've established it's your body protesting.
Yeah.
Now, the body is well armed to protect you. So when you get something happening to you, the body's able to respond to it. So if you were playing football and you twisted your ankle, the body senses injury. So it will create inflammation that is good for you. Acute inflammation is there to protect you. It'll help heal you. It'll protect you from infection. So the acute response is ankle hurts, let's just send something down there to fix it. So
and it's been sent, what is being sent down to fix it?
Yeah. So the brain is instructed that there's a problem, and through a nerve system called the sympathetic nervous system, you get a whole lot of inflammatory reactions occurring, which alerts the body to the fact that it needs to go out there to fix it.
Right.
So you get certain inflammatory markers going up, interleukins, growth factors, etc. The blood vessels swell there. These healing agents go in and do their work and fix it.
And the healing agent is what?
So the healing agents are transported through blood.
Right.
And in there are growth factors, platelets, immunoglobulins, and certain immune factors like interleukin.
Right. So these things all descend, in the example, at the point of the accident.
Exactly.
They all descend on it big time.
Absolutely.
And that will heal that acute issue.
Totally. So
Right.
in this case, inflammation is helpful.
Right.
And it's acute. The same thing will happen with an infection. If you suddenly caught a throat infection, you'll develop a fever. The body's sending the right impulses to try and fight that infection. So your T cell responses and your B cell responses will go up and try and fight that infection.
Right.
So inflammation is not bad in the acute phases. Looking at it one step further, there's something called hormetic stress. We now know through studies that this acute inflammation is actually good for you. It's a way of the body stepping its game up and also getting rid of bad things.
Right.
So we try and mimic it. So an example is cold showers. Wim Hof's work with cold showers and plunging. So what does that do? It creates a state of shock. The body steps its game up, and it creates oxidative stress, and it kills off bad things. And then you come out of the shower and the body relaxes again. And so it is known as a good healer. Inflammation is a good healer. Same with steaming, because we're built for short, sharp fight or flight, not for chronic fight or flight.
So we're sort of doing this. We have some sort of incident, which either has happened through an accident or we've created, from a cold shower or, whatever. We get this spike up, body reacts, fixes it, and we're back to normal.
Absolutely. So what happens is the body goes into fight or flight, does its job, and then comes right down again.
Okay.
That's good inflammation.
Right.
But look at our environments. We don't have much in the way of injury. We don't have much in the way of being cold or hot. We're living a very neutral environment.
Yeah.
So physically, we're not taxed as much. However, mentally we are. Now, the body doesn't know the difference. It just sees fight or flight. So the body will send impulses down, even with acute stress, anxiety, challenging emails, challenging phone calls, and create an inflammatory response. The difference, however, is the brain doesn't quite know what to do. There's no injury to command or infection, so it just sends a generic immune response down, and the immune system goes back and says, which way do you want me to go? And the brain doesn't know, so it sets a chronic, low-grade inflammatory process, not quite going anywhere. We call it a blind immune response. And we believe that this blind immune response is responsible for a number of inflammatory conditions like diabetes, heart disease, dementia.
Right. So the whole system, or big chunks of the system, are basically going mad, but not entirely sure why.
Absolutely. And because we are sensory beings, we've grown up in the wilderness, we react to physical things, pain, injury, infection. We don't understand the psychology, or our immune systems don't quite, they know something's wrong, but they don't know where to direct it. And this is one of our biggest problems in modern day at the moment. What is also worrying is that we've accepted it. So an example, the school system can be quite pressured with exams and purpose and deadlines. And then on top of that, there's extra pressure to do extracurricular events. We think it's good, and it is good, but if this becomes chronic, the body goes into a state of fight or flight. And we're seeing a lot more problems in children in terms of, as I say, protesting signals like autoimmune disease perhaps, or autism, or brain disorders at an earlier age, because we're not seeing this because it's an invisible threat.
Okay, so let me try this. If I get a virus, it might be flu and it might be something, pretty nasty or cold. I know I've learned through the years that I've got one happening because I get pains and stiffness in the base of my spine.
Yeah, that's a signal.
And what I've concluded, right or wrong, is that all this stuff is going into to fix whatever it is, and certain parts of my body object a lot more. I've naively think it basically all this stuff's piling in. So where there's constriction already, like a joint or whatever, then that's gonna moan more than other parts of the body, like a muscle or something. There isn't already a constriction or a joint movement or something.
Absolutely right.
And that's correct?
Yes. So let's think about it. Everything happens everywhere at the same time.
Yes.
So when an immune response is kicked off, it affects everything because your body works in harmony and in an integrated way. If you have a dysfunction where perhaps the blood flow is constricted due to fibrous tissue, you've got to remember the heart's job is to pump blood around. But when it gets past the big arteries, it's your vasomotor response that takes it to the fine tuning. And this is like a slow massage, a bit like
so in the veins or whatever,
in the arteries.
In the arteries,
yes,
there is a pumping.
Yes, there's a pumping
system all the way through.
Absolutely. And this pumping system can also be affected by inflammation. So if you have some chronic background inflammation, your ability to send things to the smaller tributaries is compromised too.
Right.
And so effectively, this is not just about what you can see, it's about what's happening at a peripheral level.
Right.
And so if something's being starved of oxygen or growth factors, it's going to protest a bit more.
So these things you've mentioned, just a few, which could be bad diet. It could be toxins. It could be other facets of your lifestyle, stress and so on. Together, they can all create this generalized response in the body. Some are going to be more acutely visible to you, like the aches and pains. But there'll be a whole lot of other stuff which actually will not be visible, but is still actually doing damage.
Absolutely correct. And this is the concern, that the majority is invisible. It's invisible to the conventional system. It's accepted by the individuals. So by definition, people do not look at this as a problem. And because we get through, because we endure and push through it, we put it down to other things. We're busy with work. We're busy at home. We haven't slept right. All of those are signals, And so rather than look upon it as what is it that's going wrong and what can I do to mitigate it, we accept it and it then escalates and escalates until disease, decline and disorder occurs.
Okay, so going back to what we were saying earlier, our whole medical system and now the social care system is geared 100% around, I have a problem, I go and see my doctor either fixes it, which 99 times out of 100 is going to be a prescription, or I get sent to another specialist, and the specialization funnel gets narrower and narrower, and therefore we cannot escape from this specialist doing what that specialist is trained to do.
Absolutely.
And eventually the care system, as we said earlier, doing the same thing. So there's two factors there for me, one of which we mentioned, which is the cost on the care system in its entirety is based on that model at the moment, whether we like it or not. Secondly, it seems to me like that system needs to be changed. I mean, not just tweaked, but fundamentally changed, because if I go to see not you're my GP now, but if I go to see my NHS GP, there'll be none of this conversation at all. If I went and complained of aches and pains or joint pain, I'd be diagnosed with arthritis of some kind, and I'd get a pill, or I won't get an explanation of my life, my lifestyle. How could you look at what you do with your food, with your exercise? Let's look at some of the medications you're on already, because maybe that needs to be looked at and changed and so on. I get none of that at all. So the system is self-sustaining. And which doctor in their right mind that spent 30 years building up an expertise at the top level of this set of issues is going to change all that overnight and do something different?
It's going to be different. And I think, therefore, it has to come from the patient. The diagnosis you mentioned, arthritis, anything with itis on the end, means inflammation.
Yeah.
Appendicitis, arthritis, tonsillitis. We know, we've termed it inflammation, but actually we stop there. We then look at suppressing the inflammation. So a lot of medical advice and management is about suppression. But actually, what is inflammation? And we'll come to it, but effectively, it's where the immune system has become dysfunctional.
Yeah.
It has become overloaded and no longer there in a protective way, but in a way that's causing decline. And as soon as we change the narrative with the patient, if we told you that actually your immune system is not working quite as well as it should, and it could start with your psychology, it could start with your work, it could start, tell me what might be happening that you think could have triggered this. And honestly, we must give more importance to what patients tell us and listen, because they'll tell you what's going on. And then what you have to do is inform them of the link of the fact they've had a difficult time at work and therefore cannot sleep and therefore are making inflammatory agents at night, which then begin to protest. Once they understand it, they can take steps to unwind and get themselves better, because no patients want to be on drugs. They want to get better. But there's a social acceptance to certain things going on at certain ages, and I think we have to devolve that process. Most of us die with most of our stem cells intact, by definition.
Is that right?
You've got baby cells.
So they haven't all. So I was reading something the other day, something crazy, because I try and read up on all these subjects, and it basically said that these stem cells basically they get consumed, and eventually they all disappear. And once they've disappeared, basically it's all downhill very quickly.
The reality is you have trillions of stem cells, and effectively they're still present at death. So
What proportion? So I mean, roughly. Let's say you die of, old age. Okay, 90. Give me a range of the percentage, say roughly, that could still be there in your body.
So 90 wouldn't be dying of old age.
Right, okay.
Because our genomics show that technically 120 is possible.
Okay.
So you, at 90, by definition, you still should have enough capacity to generate more stem cells. Now, if that 90-year-old had a lot of trauma, a lot of injury, a lot of operations, a lot of drugs, the cells will have to work quicker to replace. So we make 3.8 million cells every 1 second. That's our generation capacity. But if you're in the fast lane and you're getting over an injury, that cellular usage will go up. So you will utilize more of your pool of stem cells. But what I'm saying is most people don't die of old age. They die of something happening. And there will be an element of stem cell activity that should technically, if they lived in a model way, last them in that case, a further 30 years.
Right, okay. So in fact, while I was, I might have, picked it up incorrectly, but basically we've got up there in our 70s, which I am, you've got plenty of stem cells in your body to keep you going for a long time. If you're not careful, all the things that we've said can trigger inflammation, then that, I think, is what you're saying, that can consume a lot more.
Yes, absolutely. And we talk about the 12 hallmarks of aging, the things that go wrong at a cellular level that lead to disease, decline, and disorder and aging. One of them is zombie cells. So when you have bad cells or cells that haven't quite died but are still in the system, they stagnate the good cells. So it's not just about the production line, it's what's left behind. So these are cells that are not doing their job but haven't died, and they infect other cells. So zombie cells, utilization of stem cells, the toxicity around your DNA that makes you use more stem cells. So we can control this. We can create an environment around our DNA to protect the cell, feed the cell, and therefore reduce the utilization.
Yeah. Okay, so it seems step one is educate the individuals, empower them to find out from any source, including their, educated physician, what they can do personally and what might be the trigger for certain things which they've noticed are going wrong.
Absolutely. And I think this is really important because we have the most amazing immune system ever. There's no immune system like it. It's capable of doing a lot. We've talked about 3.8 million cells of production every second. If we are not well in the acute form, inflammation will protect you. Infection, injury, etc. If, however, we're put in the circumstance of discomfort for any length of time, that inflammation becomes destructive. It's chronic. It starts eating away on things that matter. It eats away at your immune system. It eats away at your micronutrition. It eats away at your gut. So what The causes this can lead to other consequences.
Yes.
And those consequences can then become a cause. So we need to understand, and we need to listen to our bodies when it's talking to us. And once we do this, we can correct ourselves.
But you need a lot of help to do this, because when my friend told me about his sister, given the limited amount of knowledge I've got, but it's motivated me to be aware of this subject. I said to them, what does she eat? What's her diet? Of course, the diet is cakes, fast food, pot noodles, no exercise, sitting in front of the chair watching daytime TV, feeling worse, and therefore it's difficult to get out, grunts when she gets out of the chair, can't quite get out properly. That means all the other stuff becomes harder, and suddenly you're in a sort of downward spiral. And I said, why don't you just stop eating sugar, because that will take away so much of the crap food. No. So actually getting through to people is honestly really difficult.
I think getting through, because you're going in with your mind.
Yeah.
You can't understand why she's not taking these measures, because you eat well, you're in the right lane across the board. When one thing good happens, everything happens and is good. And also, when you do take these things, you feel rubbish. In her case, if she's taking it regularly, her receptors are resistant to that. And she's in fight or flight. So the craving for sugar comes in because the body wants to run away from a saber-toothed tiger that doesn't exist.
Yeah.
The second thing to say.
Yeah, I like that. The body wants to run away from a saber-toothed tiger that doesn't exist.
Absolutely.
And that must be hundreds of those things in our daily life that cause that to happen. In our modern life.
All the time. And we don't see it. But what is also interesting about this case is we've now discovered that sitting itself creates chronic inflammation. When you sit, and the average person sits for about 15 hours a day, your immune system, there's a certain hormone, osteocalcitonin, I think, from the bones that helps promote your immune system. When you're sitting, you're not activating that. When you're crunching cruciferous vegetables, you're activating your immune system. So sitting itself is now a cause of chronic inflammation. And you don't have to be old for that. A lot of us spend 15 hours in an office. We don't think about it. And then we think, why are we so tired? Well, because the immune system has not been initiated and you're going into a chronic inflammatory state.
Wow. So masticating food.
Yeah.
Chewing properly, because I've noticed a lot of people don't chew.
Yeah.
They move their mouth about 3 times and swallow.
Yes.
So I think I was reading that you should maybe chew each bite about 20 times. I don't know if it's true or not, but what you're saying is actually chewing food properly doesn't just have the digestive effects. It's actually helping to stop inflammation.
Absolutely. And improving your immune system. But also we're going into the world of smoothies or softer foods. So we're not using our masseters as well, and we're not moving the jaw as we used to. Remember, all the solutions are in the genetic adaptation of where we were 1,000 million years ago. And crunchy food, using your masseters, walking, vibrating, created an immune response. We now live in abundance. We sit a lot. We eat soft foods. We use our mouth for talking rather than using our jawbones. So all of these things are depleting us. That's why I call it the invisible issue, the invisible inflammation.
Yeah. We were out shopping, my friend and I, and her sister asked her to do some shopping for her. And on the list was 20 pot noodles.
Yeah.
When we got to the shelf in the supermarket, I hadn't paid attention. I mean, I knew they existed, but I hadn't really paid attention to them. There was, from here to the other side of the studio, 5 shelves deep of pot noodle types, every single flavor, shape, size, color on the planet.
Yeah.
Unbelievable.
Yes. And the worry is, of course, the food industry needs to sell. And we know that carbohydrates are kind of addictive a little
And
bit.
cheap for the industry to produce.
So what happens is you take these in, your insulin response goes up, and it's quick energy. It's acute, short-term comfort. And then, of course, when you stop eating it, the insulin level's still a little bit up, so you crave it. And not only are you taking it in, but often these individuals are inflamed and they're making the donuts internally because the cortisol is in a state of fight or flight. In terms of your friend, I think these are the sort of cases we see a lot of. And I think for me, the way to penetrate and change is to break the discussion into multiple habits. Start slow. reduce the carbohydrate by a third for 3 days, and a further third, and the body adapts. The body wants to get better. It'll scream at you a little and explain that's not you starving, that's not you dying, because often people interpret that need as their body's need. No, the body will then move towards fat metabolism. The inflammatory markers will go down, and then we can shift into other gears of movement. I think explanation takes time. And if we spend time with patients and explain that they're broken at multiple levels, but it's fixable.
So if you think of the budget of the care system in its entirety, it's all focused on what we were describing earlier. And we're talking about massive sums of money. There's two things here for me. One is, if we do, Dr. Kapoor, what you've just said, we will remove in one fell swoop, I mean, it'll take time, a huge amount of the cost in the system. I mean, I wouldn't dare put a percentage on it, but a lot. We'd have to change what happens the moment you turn up in your GP surgery. The change has to start there, doesn't it?
I think even before that, you should never need to go to your
because
GP surgery.
we're much more aware personally.
Yeah.
Okay, and obviously with the things that are happening technologically, then access to things and the ability to control or understand the effect and therefore control what you do in response to these things is going to become greater, or at least more available to us.
Yes.
The question is, how do we encourage people to do it? The other point about the money is it will release vast sums of money that can then be reapplied to the education, to the prevention, as opposed to symptom relief,
Yes.
which is what we seem to have at the moment.
Yes. And I think the other thing is, let's not just look at that. I mean, the world market for healthcare, that's diagnostics, treatment and everything, is something in the region of $8 trillion a year. $8 trillion a year. That doesn't include the social element, but $8 trillion. The smartphone market is about $1 trillion. That gives you some context of how big this is. And it's getting worse in the developing countries. So we will not be able to sustain this unless we make a paradigm shift on thinking.
Yeah.
And for me, talking about inflammation versus talking about 126,000 disease processes makes that narrative very easy.
Yeah.
And then talking about the things that happen day to day that are causing this invisible inflammation, and how to say to you, you're not weak, you're feeling like this because the body's in a state, helps people reverse. And that's been our experience. But the benefit is huge. The other thing, of course, is this is the cost to healthcare. When people have chronic inflammation, they take time off work. They're sick. They get psychological problems. There's huge collateral damage that's existing out of this.
Yeah, so my friend works in the adult care system, and she sees this every day. And her job is to provide mobility support for people, some of whose symptoms and problems could be addressed in other ways, of course.
Yeah.
Yeah, so it would seem to me also that there's a number of big beasts in the system that may not want this to happen, Dr. Kapoor, because the food industry he understands exactly how to turn on our brains to food that's actually not very good for us, very cheap to produce, and we'll eat a lot of it. The pharmaceutical industry, I mean, okay, maybe let's be generous to them. Maybe they understand it and they're going to try and fix it, but it's not in their financial interest because the whole system for them is based on it. Then you've got the medical profession. Then you've got the political system. You know, if I was going to be a real conspiracist, there are a lot of people out there at the moment beginning to say, actually, the political system wants us to be dependent, you know? So there are a lot of things actually that won't like. Well, this is heresy. What you're saying is heresy.
For me, let's look at the food industry. In the 80s, it was about tobacco. Tobacco was an addiction, and then the tobacco companies realized, well, the governments realized they shouldn't be going down this route. What was interesting is that a lot of the big food chains were bought by the tobacco industry, and they used the same principles that they applied in tobacco to food. And that's where we saw the fast meals, the microwave meals, the sugar, the colorful sugar, the colorful candy. And that's how they marketed it. And more importantly, we were told fat was bad. So the gap was filled by carbohydrate and sugar.
Yeah.
And of course, the thinking is now changing. But at that point in time, when things are cheap, easy, addictive and nice, it's an easy place for lots of people to go very quickly to. That's the first thing. As for pharma, well, with 20,000 drugs already in place, why is it that chronic disease is going up? Why is it that mental health is going up? Why is it that suicide is going up? Why is it that autism is going up? Why is it that all these disease processes that we're supposed to be able to support are going up and not down? And now we know that the expected age that people live is dropping too.
So I heard that, yeah.
So the model clearly is not working. And more important, people are more unhappy, have more anxiety disorder. So for me, we need to strip back again and reconsider how we do it. So it's very important. Now, pharma, a lot of medical research works on randomized controlled trials. A randomized controlled trial is you put one intervention in to a group of people, and you possibly put a placebo in another group of people. But the people are matched so that there's nothing apart from that intervention that's relevant. And then you look at an outcome. And if the people taking the drug are better based on the fact that they are looking for one outcome, an example is my cholesterol's high, I take a statin, my cholesterol drops, that's okay. So it's a very A to B linear relationship. Now, I've just told you you've got 3.8 million cell productivity every second. You've got close to billions and trillions of processes going on in your system. For me to just look at one of those systems and assume there's an outcome is very simple. We don't look at the collateral things that are going in the rest. So we look at A to B of the alphabet. What about the rest of the alphabet? When the body fixes itself, it has a duty of care for every single cell. So when it does something, it ensures that the system is all working. There is nothing better than allowing your physiology, your immune system to work it, because it's got a sense check on everything. The drug does not. Equally, it may block receptors in other areas, which are not covered by the randomized control trial. So, or we haven't taken into account the context of the individual's lifestyle, their sleep patterns. There's so many variables. The body knows them all. The body keeps a score on every variable. The drug does not. So I'm not surprised we're not seeing resilient outcomes. I'm not surprised that when I see my patients in the cottage hospitals, they're on 20, 30 drugs, and we stop half of them sometimes and they start getting better. So are we buying quality of life? Are we buying independence? Are we buying resilience through the current system? I think not.
Well, it seems to me from what you said, unless we can fix this, then the cost of our health and care system going forward will actually be beyond reach.
Absolutely. And then the third point you made was the institutions and governments. Now, governments tend to subcontract to consultancies. They subcontract a decision-making to big consultancies and therefore respond to what the consultancies say. Now, if the consultancies have a vested interest, you could ask how biased that advice is. We know that with FDA approval of drugs, a significant proportion of their funding comes from pharma companies. It has to. It's a very expensive process. But again, there may be some bias coming in. And pharma are there for profit. So, but I just feel that this needs to just be unwound, and we need a reflective period. And I'm confident with the work we've done already that through explanation, we can see a change. And the most important thing is, are you better after these interventions? And most people say yes, but they need to understand that they're not broken, they can be fixed, and they have the capability to do so.
So final question. You're 55, you've got aches and pains, you feel a bit lethargic, your energy's low, your head's a bit foggy, motivation to get up and do things has sort of not been great. Is it too late? Absolutely. Or are you destined to be on this sort of downward curve?
It's 100% not too late. But let's look at this individual. This individual, male or female?
Female.
Female. This individual is in the mid-50s. They will have hormonal dysfunction. Now, we think about hormones as just about menopause. We know that's not true. Hormones are the lanes on the highway. They're the things that move everything around. If you have a roadblock, however good your diet is, things can't move from A to B. You need to feed all these 30 trillion cells. So hormonal decline can sometimes lead to us becoming sluggish, slower. And again, we accept this as aging. But the reality is, if we can restore these highways in a sensible, monitored manner, those highways will carry on working. The potholes are fixed, so the nutrition can work from A to B. Then we talk about the nutrition. With inflammation, your primary immune system that has to deal with it is your gut, your small intestine, your 27 feet of small intestine, which is paper thin, 300 square feet of surface area, holding 23 trillion bacteria, and it's your primary immune system. It sometimes has to combat more in one day than your whole internal immune system does in a lifetime. That's how powerful it is. Through ultra-processed food, through stress, through various mechanisms, your primary guard goes down. And any conversation that we have with patients must be about protecting and fixing the primary guard. Because if we don't fix those leaks, the internal system depletes. So we explain why we're doing this. So you fix this individual's primary guard, you restore the restorative hormones if needed, but then you look at other micronutritional depletion. If you're inflamed, you're using energy, going nowhere. It's a car on at night, going nowhere in the garage, utilizing your energy, fixing chronic inflammation that's doing nothing. So you're going to be depleted. You're going to be depleted in immune modulators like vitamin D, potentially ferritin, magnesium, zinc. These are powerhouses for your immune system that are being utilized and going nowhere. So we refuel there. We then refuel so once we refuel the immune system, the hormones, and fix the gut, your natural energy, your mitochondrial energy, the only energy that matters, ATP, then is not overutilized doing things that are going nowhere. And you then pick up. Then your mood picks up. So the body feels joyful. You do more. You want to do more. Then the insulin resistance drops. So you eat less rubbish. So it's everything happens.
Now the spiral is going upwards instead of downwards.
But the sad thing is we're accepting it.
Yeah, and that's the problem. We all need a bit of help.
So this 55-year-old can reverse.
Yes. Excellent. Well, what we're going to do in the subsequent episodes, we're going to drill into topics you've just mentioned and see if we can find some specific things that people can actually do for themselves.
Super.
Meanwhile, thank you.
Thank you very much.